Have you been excessively tired for a really long time? And now every time you go to the doctor to have this worked up, they tell you that either nothing is wrong with you, or better yet, that it's all in your head? This is a common story I hear from many of my chronic infection patients. And now it is not the only cause of fatigue by any stretch. It is a lot more common than most people realize. And unfortunately, it is very poorly managed in our conventional medical system. Now, our conventional standard of care is very good at dealing with acute infections. When you first get something, you mount a huge fever, you perhaps getting body aches, things are detectable on standard routine blood work, and the diagnosis and treatment is fairly straightforward. But for chronic infections, up until very recently, a lot of medical practitioners didn't even believe they're a real thing. And part of this is due to the poor testing when it comes to chronic infections. And then the other part is that it tends to present a little differently. The symptoms aren't as obvious. They don't follow a textbook example. They're often a combination of excessive fatigue with other symptoms that don't seem altogether related. But if you understand how chronic infections work and how to properly evaluate them, it can start to make a lot more sense for people. So the medical community as a whole is just starting to acknowledge a lot of these chronic infections like Lyme disease, mold illness, chronic Epstein-Barr virus, yeast overload. Honestly, the list goes on, and we are just starting to figure out that this is a real valid problem for a lot of people. So in today's episode, I want to talk to you about some signs and symptoms you can look into that might lead you down the path of chronic infections and how to have these things properly worked up. And hint, hint, a lot of the times you have to go outside of the standard testing, outside of the conventional model to get some of these things worked up. Because as I've mentioned, it hasn't been recognized for a long time. And so we do have the technology to detect a lot of these things now, but it's still in its early stages and it's not exactly built into our conventional care as of yet. So today, that's what I'm going to talk to you about. But first, I should probably introduce myself. My name is Dr. Robin Lewis. I'm a naturopathic physician practicing here in Vancouver, British Columbia, Canada. And today, let's talk about whether or not your excessive fatigue is being caused by chronic infection. But before I get into all things chronic infection, I want to just first mention things that could easily get detected in basic blood work, and those are very important to have ruled out so you don't go down an unnecessary rabbit hole. But also, if you do end up at some point testing positive for one of these chronic infections, it's also extremely important to have these other things assessed because your whole body and your current health status will play a huge role on how quickly you can recover, some things you may need to do to support the body in order to even fight that infection, and so on. So I'll just briefly mention these things, but these are also causes of fatigue that I would recommend looking into that are outside of the context of chronic infection. The first thing would be thyroid. Our thyroid has a huge role in our metabolism and our energy. So of course, if you have a thyroid condition, it could explain some of your fatigue. Some basic nutritional studies. So if we're talking about standard labs, they can evaluate things like your B12, your iron stores, your vitamin D, and certainly deficiencies in all of those can create a fatigue picture. We also want to look into antibodies because autoimmune conditions are extremely hard on the body. Just having your basic red blood cells and white blood cells looked at because this is ruling out things like anemia, various different types of cancer. You also want to look at your hormones. And so thyroid is one of your hormones, but I'm talking about sex hormones. So if we think about something like testosterone, having low testosterone is extremely related to excessive fatigue. Blood sugar studies are also very important because those spikes and drops of blood sugar are extremely draining on the body. So it could be an undiagnosed type 2 diabetes or just really volatile blood sugars like reactive hypoglycemia and things like that. So again, this list isn't going to be complete. I'm sure there are other things, but these are some of the standard things that I'm measuring in people who are trying to explore their cause of fatigue. And these are great things to have done before and during the treatment of chronic infections. So these two things are not necessarily mutually exclusive. They relate to each other. So it's also important to note that some of these things can show up also if you have a chronic infection. So none of this rules chronic infection out, but if you also have any of these issues, it's going to be important to address, and the chronic infection itself can affect some of these markers. So having a thorough whole body picture is extremely important. Now, that is not the point of today's episode, so let's dive into some of the more chronic infection related things. So if you're starting to investigate chronic infections, one place I like to start is by evaluating your environment, because that can often give really helpful clues that lead us down this path. So in the example of one of our environmental exposures, I'm talking about bug bites. So we can think about things like ticks when we think about Lyme disease or some of the other co-infections and other bugs that can be transmitted through a tick. If you have some sort of bug bite, you can either feel it, sometimes you feel it or not. Sometimes it presents in an acute rash with some other signs of infection like fever and body aches when you initially are exposed to the bite. But not everyone sees these rashes. Not everyone feels the bug bite, or at least acknowledges it as something significant in their day-to-day lives. Now, it's not just ticks. Other things like fleas, mosquitoes, sandflies, things that we pick up from our animals can infect us, like parasites. And so taking a second to think about your environment, where you work, things you've been exposed to, bites in your environment, that can be extremely helpful, giving clues as to the onset of some of these symptoms. Another really important environmental exposure that you want to pay attention to is water damaged buildings or any other potential exposure to mold. Now, mold is one of these chronic infections I actually see a lot of, mostly due to where I live in the world. Vancouver is very moist. We get a ton of rain. We have a lot of old buildings that have hidden mold in it. So it's not always as obvious as like, oh, I see a big patch of mold on my wall. Sometimes it's under the floorboards and you'll just see a mild bubbling. Sometimes you'll walk into the room and there's a musty smell to it. Or you go to do a renovation and then you find the mold behind the drywall sort of thing. So the mold isn't always entirely obvious, but certainly if you do have something obvious, like living in a moldy basement suite or working somewhere where you know mold is in the building, that also is something that you really want to pay attention to and potentially will clue you in to mold being a potential offender. Now, the last environmental exposure is very vague and very broad, but I do want to make sure you're aware of it, and that is exposures through our food and our water. Now, I'm usually thinking of things that have to do with gut-related infections, so you can have a chronic parasite, overgrowth of some of these bad bacteria or viruses or yeast that live inside of the gut, and certainly some of this can start with like a bad batch of food poisoning that kind of sets everything off, or other exposures in our food and our water that can expose us to these bugs and give them an opportunity to kind of set up shop inside of our gut. Now, we don't always think of gut-related infections in the context of fatigue, but of course you're going to be tired. If it's sapping all your nutrients, if it's created a really volatile gut environment that is not conducive to good absorption of nutrients, you have a high amount of inflammation and leakiness inside of the gut, that is going to translate to fatigue among other symptoms. So those are some of the things in your environment that you can pay attention to that may give you a clue. Now let's talk about the symptoms. So of course, the theme of today's episode is fatigue, and that word in of itself is quite vague. We can say, oh, I'm feeling tired after just a bad night of sleep, Or it could be the level of fatigue or tiredness where it's so debilitating you can barely get out of bed in the morning. So it's quite the spectrum when we use that kind of language. And people with chronic infections do tend to present on the more severe side of the spectrum. So these people are often slapped with the label of chronic fatigue syndrome. Or if they haven't gotten that diagnosis yet, they are at least having a more severe type of fatigue, generally speaking. And there's some other things about the fatigue that can also be little clues as to whether or not it's an infectious cause. So these chronic infections will generally make you extremely tired most of the time. But one thing that is very characteristic of these infections is you can have periods where it's really bad and periods where it's much better. And a lot of this has to do with the activity of the bug. So a lot of these bugs can go dormant. And so when they're dormant and not active, you tend to not have very many symptoms. And when you are going through these periods of excessive fatigue, they do tend to come with some other symptoms that are clues into the type of infection. So, for example, Lyme disease. If it's really bad Lyme disease, then yes, fatigue is there. Sometimes it's affecting your mental cognition. So, extreme brain fog, memory troubles, loss of words. There can be joint pains. So, this could be achiness inside the body that travels from place to place. In extreme examples, you will get swelling of joints if the infection is very, very bad and has been set in for a while. And some of these infections are a lot more subtle than others, but yeah, usually it'll come with some other signs. So whether that be vague things like body aches, brain fog, or more pointed things like joint swelling, rashes, things like that. And if we talk about something like mold, the fatigue or some of the other symptoms associated with it, like headaches and stuff like that, they can be related to the environment that you're in. So some people, especially in mold, will go into a building, some moldy building, and their symptoms will increase. They'll immediately not feel well in that particular environment. Or if it's something like mold in the home, they feel really good every time they go stay at a friend's house or they go on vacation, which is very confusing because a lot of people will feel good on vacation, but it's usually like you enter a space and your symptoms worsen. You feel a lot better when you're outside of these moldy spaces and a lot worse when you feel that you are inside moldy spaces. So that is also another very interesting clue that can point you in the direction of a chronic infection like mold. Now, as I'm sure you're beginning to realize, these infections can present with a wide variety of different symptoms. So depending on the type of bug you're infected with, or even just depending on the person, it can present very differently. But fatigue is definitely a common theme. But ultimately, this is where testing comes in because it's very hard to know what you're infected with without a test. Of course, there's some signs and symptoms you can look at that are very indicative of certain things, but ultimately testing is the final say. And as you will notice, as I go into some of the testing around some of the more common bugs that I see, there is a big difference between conventional testing and some of this private lab testing that goes above and beyond the standard. And a lot of this has to do with the fact that you have to test things differently depending on when they first set on. So in the case of Epstein-Barr, the first onset would be you getting mono as, let's say, a teenager. That type of testing looks very different than something that is chronic and reactivated. So Epstein-Barr that creates mono in its initial stages can lie dormant, and when it reactivates, you have to use different testing methods to pick that up. So this is my way of saying that there is a difference. I'll try and outline the difference a little bit for you, but know that if you had a standard workup, oftentimes that's not sufficient for a chronic infection. So let's start by talking about mold, because this is probably one of the more common ones that I see in practice. And that has part to do with the fact that I live in a very moist part of the world, like Vancouver, but mold can ultimately be anywhere. And interestingly enough, there isn't actually a very good conventional test for mold illness. They're very good at testing for mold allergy, which can be a thing as well, where you mount an allergic reaction to mold. And so when I'm talking about mold workups, that's the one I'm used to seeing conventionally done. But you can have mold illness without a mold allergy. Those are two entirely different things. And so when you go to investigating mold illness, different from the allergy, that's where the conventional testing doesn't really have a good option, and people will often have to go private. And what I'm used to using in practice is something that picks up the toxins that these mold bugs or spores will produce. And these are called mycotoxins. So I'm used to running one where you pick up the mycotoxins in the urine. And this is done through ELISA testing typically, where they're measuring different antibodies against these toxins. Another form of testing that you'll sometimes see practitioners using is swabs of the nasal cavity, because mold loves living up in your sinuses and in your nasal passages. And so sometimes you're able to detect the bug by swabbing and then culturing. I'd say it's not done very often, but that is another method used. Another method you'll see some of these private healthcare practitioners using is something called OAT testing, which stands for organic acid testing. And this can measure a lot of different metabolites inside of the blood. And it does include a couple of the fungi, but I will say it doesn't cover a very large variety of them. So sometimes people will have OAT testing to investigate some of these mold related things, and they'll show up negative, and that doesn't exactly mean you don't have mold. Perhaps you just didn't have the type of mold that is detected on that particular test. So that one's good, but it's very limited in what it can detect. Okay, so now let's move on to Lyme disease, which is an infection of the Borrelia species. So Lyme is just a loose term for it. Now, they do have conventional testing methods for this type of infection. What they're typically using is things like ELISA or immunoblot testing, where they're looking at antibodies in relation to that bug. So these are things like IgM and IgG, and they're trying to detect the bug through measuring those things in the blood. So the urine test that I mentioned was also looking at antibodies, but that's in the urine. This conventional testing for Lyme is looking for antibodies in the blood. Now, there's a couple issues with the conventional method of testing. The first being that if you know that you have a tick bite, and so you go to your doctor right away, it does take about 4 to 6 weeks for your body to mount the reaction that is detectable in the blood. And so sometimes testing too early can give you a false negative. And then the other issue is they use a 2-tier method, which means they'll run the antibodies once on a blood sample, and only if that's positive will they run it again to double confirm that you have Lyme. And unfortunately, Lyme is notoriously hard to detect. And as I mentioned before, depending on the timing of testing, you can have Lyme disease, but it will not show up on that test. So there's a lot of false negatives that come along with the conventional method of testing. It can detect a lot of people, but it can also miss a lot of people. And these are people who will often go back for further testing later on in life because they're not convinced that that first set of testing was entirely accurate. So you can run some of these antibodies again later in life, and if there is a chronic infection, they're usually detectable. In a perfect world, we would also be able to pick these bugs up on culture. So you could take a blood sample, detect the bug directly, not measuring the antibodies produced by it, but looking directly at the bug. The issue with that is Lyme, or the specific bug associated with Lyme, Borrelia, does not replicate in high numbers. So it's very hard to find a sample that actually has it. So again, you get a lot of false negatives with that one. And then the third method, so there's the conventional testing, which is the two-tier approach. Oftentimes you can use similar methods at a later time with private lab testing, and maybe you'll catch it then. If you do get that initial negative, there is the PCR and culture, but again, lots of flaws with that one, very hard to detect Lyme with that one. And then sometimes you'll measure something called T cell reactions. So we have specific immune cells called T cells that will have certain behaviors that are related and very indicative of a chronic infection. So this can be helpful for monitoring disease activity, tracking progress. Are the numbers coming down, sort of thing. So depending on the type of infection, they can have different T cell patterns. And again, that's usually a private lab type of testing. But one of the take homes I really want you to understand about Lyme disease is that sometimes you will need to repeat testing quite a few times before you get that positive result. And if your signs and symptoms are really indicative of Lyme, or you're not convinced that you do not have this infection, even if you did have your standard workup, I would encourage you to get retested, because it's one of those bugs that is just really hard to detect. And the third and last one I want to mention, because it is also a very commonly overlooked cause of fatigue, and that is something called Epstein-Barr, which we more commonly know as mono. So a lot of us have had mono in early adulthood or teenage years, childhood, and that is very well recognized. There's good standard testing for when you first get infected. It typically follows a very clear pattern of excessive fatigue, swollen lymph nodes, sore throat. In extreme cases, it can cause spleen and liver enlargement. But ultimately, it's not the acute infection that I'm talking about. That is very well recognized, and it's usually self-limiting within 2 weeks. The interesting thing about this particular bug, though, is it never fully goes away, or at least there's a lot of reasons to believe that it does not fully go away. It just goes dormant inside of the body. And so for a lot of people, they can have their initial infection and go back to business as usual, and they may be fine for the rest of their life. But in other individuals, they can get what we call a reactivation later in life. So this could be years or even decades later, when the body's super run down for various different reasons. These bugs can start to become more active again and create a reactivation syndrome, which can look similar to the acute infection, but it's certainly not the same. And so conventionally speaking, they will measure, again, antibodies in the blood. They'll measure things like IgM and IgG. Now, the IgM is more related to the initial infection. So you'll have elevated IgM for usually up to 3 to 6 months after the fact. And then IgGs can be more related to the chronicity of it. But there is a very specific IgG that is associated with the reactivation, and they call that the early antigen IgG. And so this is the type of testing that you're looking for if you suspect reactivation of your Epstein-Barr. And there is a lot of interesting literature coming out that is linking chronic Epstein-Barr to a lot of other conditions like autoimmune conditions and various other inflammatory conditions of the body, of the nervous system. So it's not a great bug to have activated in the body. It can create a wide variety of different symptoms, with fatigue being one of the more pervasive ones. And it is more common than you would think. And it's finally getting the airtime that it should in the medical literature. So these are the top 3. By no stretch are these the only 3 infections that could cause your problems. So this is where I really recommend working closely with a practitioner who is well versed in chronic infections that can help you narrow down the list. The tricky thing about chronic infections is there's often a lot of overlap between symptoms. Fatigue can be caused by a million different things, joint pain and body aches and headaches. Those can be created by so many different things. And so this is where having someone who knows what they're talking about can be really helpful. Getting those tests to further clarify rather than guessing which infection you have, because there are really great treatments for a lot of these chronic infections, but you do need to know what you're doing. You do need to treat the right bug with the right thing. These are not easy things to get rid of. These bugs are incredibly intelligent and very good at evading treatments and evading your immune system and things like that. And so I highly recommend working with a doctor who is well versed in these things and getting testing to know exactly what you're treating. So I hope that was helpful today. I hope that for any of you out there who either yourself or your loved ones are dealing with really excessive fatigue and they're not getting the answers that they should, then this might be something worth thinking about. If you have any chronic infection related comments or questions, please mention them below. Unfortunately, I'm not able to give any sort of medical advice, so no direct questions about your medical health. I'm not allowed to answer those, but if you have more broad questions, by all means. Thank you again for listening. I hope you enjoyed today's episode, and I will see you again soon.